lines. We have our cuff on, and we have our pulse ox on. We're going to put his ECG monitor on. When you first get your patient, then you want to put the leads to this screen go on the ones that are red and white and that are taped on, not the metal pieces. Okay, so let's do that. Okay, so I'm going to touch. Okay, I just touch right here and I get the ECG. I also get a monitor here, and I can now set our limits. The high limit that's set here is 130, the low limit is 50. But say I want to raise that high limit just a little bit, maybe to 140. Okay, so if I want to do that, I can just go like that. It goes automatically there. The low limit I'm not so comfortable with. I think I'd rather have it to 60 because this guy gets a little tachycardic. So, and he's been 140. But I don't want him to go down to 160. The alarms, to turn them on or off, you can see when this is on, then the alarm is off. If I turn it on, when that goes away, you can see the alarm is on. You can fix the volume, and as far as the ECG lead is concerned, we only have 3 leads here, so we can see leads 1, 2, and lead 3, as you know. So if I want to see a different lead, then I'll maybe do a lead 1, and then it might look a little bit different. Typically, lead 2 looks very good. Okay? All right, as far as the SpO2 is concerned, if you have trouble where it doesn't read it, then take it off and put it on again. Sometimes that's just a little glitch that we have to do again. It's probably the way it is in the real world as well. So if I want to change that, we can see our O2 sat now is 98. We're very happy with that. He does not have oxygen on. Okay, so he should be pretty healthy. Okay, high limit of 100, it's certainly not going to be, it probably won't be 100. The low limit is set at 90 and the DSAT limit is set at 80. Now, I'm not very happy with the DSAT at 80, so I want to make it 90. All right. All right, there we go. Okay, so I've set that. I've got, again, it's the same thing. Either you have your alarm off or back on again. So there it is. If you have any other parameters that you want to change, you can go ahead and do that. This is continuous, so it's not like you're going to be asking it to monitor it at intervals because you're going to see it continuously. Next, the blood pressure. Here we have, let's turn that on this way. Now, what we can do is I'm going to click that again. I get the same kind of menu, and again, I can set my parameters. So I have my systolic high. Say maybe I want to change that to 150. So I'm going to push this 160, and I'll get my menu, and I'll go to 150. It'll automatically go in there. My systolic low 90 is pretty high. I think I'm going to put it down to 80. So, okay. My alarm is on, as you can see, and this NBP, non-invasive blood pressure, is on. So now, what if he gets in trouble and we have a lot of activity and we're giving IVs and things change, and I want to set it to automatically go off? So what I'll do is I'll make it auto, and then I'll set the time. I'm going to want to do it every 2 minutes. So that way I know I'm going to get a reading every 2 minutes. You can do it whatever interval you think is appropriate for your situation. So right now it's reading the blood pressure. When you hear that noise, then it's working on a blood pressure, and then you should see your blood pressure there. If there's a situation where you want to take a manual blood pressure, all you have to do is push this button here, and then you'll hear those noises again, and it will take another blood pressure for you. As far as the CO2 setting, we won't have that on because that's what you're going to use if your patient is intubated, which we don't have the capability of doing. Okay, be sure you practice this. All of them are very intuitive and they're all similar.